Hey guys, this is Mrs. Woodruff, and I'm excited to announce that I am going to start doing some skills videos. Keep in mind, you all took skills your first semester, and you probably have a little PTSD from the very sequence based, like, oh, you have to do all these steps. This is not, as deep as you probably learned the first semester. What I really hope to achieve with these videos is just to give you a basic understanding of different IV skills, physical assessments, medication administration, stuff like that. Today's video, we're going to be doing a peripheral IV insertion. Now, some of you probably have done this, so no judgment of my technique. Everyone finds their little different way. I'm going to kind of show you some tips and tricks for stuff that worked with me, and then you can feel free to, also use other resources if you find something else that, you find works better for you or makes more sense to you. Like there's probably about 50 ways to turn a tourniquet, but we all have our own different way. So first step in a peripheral IV insertion is going to be to gather your supplies. So I'm going to need a pair of gloves. I'm going to need an IV catheter. So I have that here. I need a flush to check the patency of my IV. I need what's called a pigtail, and this is what a pigtail is. It has a little end here with this cap, and then the end that attaches to the medications, if I gave medications. And a lot of this stuff can be found in the little, some of this stuff can be found in these other extra little kits. But then I need a tourniquet, and then I'm going to need some sort of gauze in case for bleeding. And then also Band-Aid in case I miss, and some alcohol prep to clean before, and some tape. So for me, before I put an IV, first I always want to think about what am I using it for? Like what size catheter do I need? If I'm going to be infusing some really intense stuff, I'm going to want a larger IV catheter. Whereas if I'm not needing it for too much, I just need it for maintenance or just in case, a smaller catheter would be okay. Regardless of what I want to infuse, I also have to think about that patient, and I'm going to have to look to see what's available. So I can sit there and say, oh, I want an 18 gauge, but it may not be possible in that patient. For me, the next step is I always like to go and look at the patient. I don't want to, sit there and just start poking around without knowing kind of what the patient has to offer. So what I do is I go and I introduce myself and I let them know, hey, I need to insert an IV. There will be a little bit of a pinch or a pain with this, but I promise I'll keep it as minimal as possible. I would put my gloves on. I'll do that here in a minute to kind of show you the whole process. But usually I start first by just looking. So I'd grab my tourniquet and I'm going to face this over so it's not just looking at me here in a sec. Well, actually, I'll probably do that first. Let's do that. So here's my beautiful arm. Thank you, TCC, for this wonderful arm and equipment. All right, so I kind of have my own way of putting on a tourniquet. This video is not to show you how to put on a tourniquet, but you like to have an easy release. So now I've put my tourniquet on, and what I start to do, I've washed my hands and they're nice and clean. I find that like when I'm just looking, I like to look, and have my fingers available where I can feel on their skin and feel if there is a good blood vessel there. Some general suggestions, from my own experiences is that when you're doing IV insertion, usually the easiest place to get an IV is going to be what's called in the AC or in the antecubital, but a lot of times those are harder IVs to maintain. They go bad quicker, and then the patient, every time they bend their arm, sometimes the IV pump goes off, which creates more work. So sometimes it's my goal, if I can, is to find one that's in the, let me push this down, in the lower arm or up higher, kind of in the brachial area, etc. And so if I can find one there, that's great. Keep in mind, I would never usually keep the tourniquet on for this long, otherwise, since I'm talking at a real patient. So I'm going to start looking here and try to see a blood vessel, see what I can find. As time goes on, like when I first started, I always thought you have to be able to feel it. See it very well. I always thought it was about seeing it. I wanted to find a vein that I could see that just popped right out at me. But with time, I've actually learned that you want a vessel or a vein that is, you can feel very well, like that's bouncy. So I'm feeling here and I'm feeling for something that's bouncing and very easy to palpate. So sitting here palpating my different blood vessels. I think I found something. So at that point, now that I think I found something, I'm going to take the tourniquet off so that I can give them a little bit of a break. And then I'm going to set up everything so I have it close by. So I have my gloves, and I'm not going to put gloves on for the video, but no, in real life I would. I'm going to set up, what I'm going to do is, this is what's called my pigtail. I'm going to get that set up. I'm going to attach. Obviously, this would be sterile and clean, but I would clean it if it was not. I'm attaching it. It's what's called a lure lock. And I am going to flush a little bit of fluid in there. And it's not going because it's clamped. That's a good measure to see if you're paying attention. So I'm priming this tubing. So think of when you prime IV tubing, you do the same thing here. So I have very close by my pigtail, that way that I can attach this. What do you call it? I can attach this. So when I'm ready with my IV, then I'm also going to get my tape ready. So with my tape, I like to have a few pieces of tape, and I like to put it usually on the end of the bed so that I have it all ready for me. So I like to take a piece of tape, and then I like to rip it in half. So I have two kind of thinner pieces of tape, and then I just put them on the edge of whatever surface that I'm working with. So I usually have two pieces of that, and then usually I just have, I always make a couple just so that I have plenty. Alrighty, so what do you call it? Now that I have that, I'm just checking to make sure that I have everything that I need. The other thing that I like to do is I like to take out my catheter, and this is a 22 gauge, I believe. So I take this off, and again, I would have gloves on during this. And so with these catheters, there's this part that's a color. What I like to do is, because when these first come in a brand new one, I think this one may have been used, I'm not sure. You know, they're going to be a little tight. And like what we want to do is, you should be able to twist or click. So you kind of twist it a little bit. You should have movement, or sometimes I kind of just go up and down a little bit just to make sure that I have, oh, 1 second, without breaking this one. I think this one might be broken anyway. All right, let me get a different one. Let's try again with one that might actually work. Let's try this. You'll see in the skills video, there'll be a lot more bloopers. So, so this is one that just came out. So I'm going to just give it a little twist back and forth and up and down just to make sure that this moves, because otherwise sometimes they can jam. So I'm going to do that and put that together. So now that I have everything set up, I'm going to go back to my patient, and I am going to let them know, okay, I have all my supplies. I'm going to get things ready. I'll put my gloves on again. I'm going to refasten my tourniquet. Alrighty. And then, what do you call them? And you may see, like in real practice, you're going to see some nurses that are going to pop off their finger, their glove. You're really not supposed to do that, because what you'll see, it's kind of funny, is you'll see sometimes is that they'll clean and then they'll touch with their finger where they cleaned. And the whole point is you're cleaning it to hopefully not touch it again. So if you feel like, you know, you're having that anxiety, you're like, oh, I got to make sure that I got the right spot, you know, feel it first again, one last time to get in your head, I've got this, and then clean it after. So I would clean my site and make sure it's nice and clean and give time for drying. And then I have all of my supplies nearby and close to me. And the one supply that I think I forgot to mention, because it wasn't in the pack, is also a Tegaderm. So I've got my flush with my pigtail. I've got my IV catheter. I've got my tape ready over here. I have my gloves on. I also have a gauze in case of bleeding. And so what I would do then is I would visualize the blood vessel that I want to do. And when I'm ready, I'm looking, and with this catheter, I always want to make sure that what we call the bevel is up, that it's pointing in the right direction. And so then for me, one of the most important things, especially because you're going to find patients that have different levels of, like, you know, different skin layers and stuff like that. So when you grab them, I always like to have a good firm grip, and then you're going to pull back. So if it was on the hand, you kind of pull back on the skin. If it's here, you want to pull back, because otherwise sometimes you think you've got a blood vessel, but it's actually going to move on you. So I'm going to pull back a little bit on this. And then what I'm going to do, again, I would have gloves on, but I'm going to look here. Everything looks good. I'm going to visualize my vessel, and then I'm going to tell them 1, 2, 3, and poke. So what I'm looking for now, and I'm going to stand up a little bit so I can see, I'm looking for blood return. So there's a little chamber in this IV catheter here, and within it, blood will start to fill up. And the second you see it, don't move back and forth. So pretty much I have my one finger up here. I have my other fingers wrapped around the sides, and I'm moving around until I can get some blood return. So this is the part that most nurses dread because they're so worried about hurting a patient. And yes, we definitely do not want to cause any harm or hurt a patient, but sometimes we have to dig around just a little bit in order to get what we're looking for. I think I just about got it. It's hard to tell with these arms. 1 second. Let's see here. See where I feel good about it. Okay, yep. So I see my chamber start to fill. So what I'm going to do is I'm taking this top finger and there's a little device here and I'm going to just push forward this. Then what I'm doing with this hand is I'm pulling back simultaneously till I hear a click. So at that point, I'm going to undo my tourniquet. And then what I'm going to do here, because there can be some bleeding, is I'm going to take a 2x2 and then I'm going to use both my hands in order to do this. I'm going to get my pigtail ready to attach, undo my thing there. So what I'm doing is I'm putting pressure above where I got the IV in order to stop bleeding from coming out as I am putting on this pigtail. So, and if you got the IV in a good place, trust me, it's going to bleed. So now I have my pigtail attached. I have this here. So now I need to secure my IV. So what I'm going to do is I'm going to grab some of that beautiful tape that I set myself up with over here. I'm going to, and there's many different ways to do this. You'll see some people do like a wraparound technique to secure it. I'm not trying to make my tape look perfect. I do like a very good well-made IV dressing, but I'm not trying for perfection today. And with these arms, tape does not stick as well. So I put some tape to start on my dressing, and then I'm also, and by the way, once I get my first tape secured, what I do is I go to my flush and I make sure that I can get some flush return, and make sure that there's some blood return back, and I see blood return into my, flush. So I know that I have a good IV. So now I can take this off and I can clamp this. And then what I'm going to do is get my tegaderm on. So I would come and open this. And then I'm going to place this on as such. Nice and easy. Take this off. All right. So I've got all that. And then I use that one little last piece of tape, and I like to secure this to keep this in place, because this is going to be where I go and I give all my IV medications. The last step, and usually there's something on the tegaderm itself, has a little place where I can attach this to the IV and actually put my name, my date, and when I put this IV in. Every hospital is different for how long you can keep an IV in. Some hospitals it might be 4 days, some it may be 7 days or longer, just depending on your facility. So you always want to know your facility's procedural, or what their policy, that's the word I'm looking for, policy that you would have for that. So yeah, and then on a regular basis, it's really key every shift to make sure to flush these. A lot of nurses, they don't flush them, they're not using them, and these IVs end up going bad, and then we have to stick the patient again, and we always want to avoid sticking the patient more than we have to. So always be looking for opportunities to keep these patent. So just once a shift, go in and flush it, make sure it still works, make sure it stays clamped, because that helps to make sure to keep it patent over time. Well, I hope that this video helped to kind of get you set up for IV insertion. It's a skill, trust me, that unless you do it on a regular basis, it's a skill that you have to continue to practice. So if you work somewhere like ER where you're putting them in all the time, you'll probably get better at it. But just know there's some places where you might not get as many opportunities, but who you are as a nurse is not based on if you can get an IV in or not. Even amazing, phenomenal nurses have good and bad days. So I always say it's the luck of the draw. Don't define yourself by it. If you get one in, great, cool, that's awesome. But know there's so many other things in nursing. This is a skill that you'll develop with time if you need to, depending on where you work. I'll see you guys for the next video.